Good afternoon, Los Angeles. I hope this finds you and your families well. I hope that you're getting through this season with a little bit more hope and joy than a year ago when we faced some of the darkest and toughest days in our city's history. I want to thank you all for being here again. I know it's been a few weeks since I've given you an update on everything happening with the COVID-19 pandemic, but this is a really critical moment, and I wanted to address Los Angeles, catch you up on this moment, make some sense of where we're going through and what we're going through as always, and give you some things that you can do to protect yourselves and your family. We're facing a new enemy in our fight, and even though we've made tremendous ground since last year, and I want to thank everybody for everything you've done to protect yourselves, your family, your city, and this world, there's a lot of things we still have to do to face this new variant that has come forward, a variant of concern called the Omicron variant that we heard President Biden speak about today. He identified a number of things that we can do, and my message is simple to you. Get protected, get tested, and stay vigilant. Get protected by getting vaccinated and getting boosted. Make sure that you're tested so that you know the status of yourself and people around you, especially loved ones, that you'll be with during this holiday season. And stay vigilant. Wearing masks, keeping social distance, being aware of indoors and ventilation, all of those things that we learn that can continue to help us make progress. And let me say very clearly, we're at a very different point now than we were a year ago. But some of the stats that are coming forward are pretty frightening. Omicron is doubling every 1.5 to every 3 days. And we've seen a caseload here in LA County go from about 1,000 cases just a few weeks ago to 3,000 cases a day right now, tripling in a very short time, even before Omicron is here. And as we saw in South Africa, where Omicron took over as the dominant variant in just a month, or in this country where now about 3/4 of all cases are estimated to be Omicron, we know that this is a very fast-spreading variant. In fact, it also will give you 5 times greater chance of being reinfected, even if vaccinated. So this is a variant of concern for all of us. We have to make sure that as we head into the holiday season, as some of us travel, as some of us bring travelers home, as we get together with folks we haven't seen in a while, that we do everything that we can to stay safe. So it starts with that first thing. Get vaccinated and get boosted. Right now, we have 84% of our 12-year-olds and over at least having 1 shot in LA County. That's an impressive number. And 1 shot almost inevitably leads to 2. That means that we're getting close with 12-year-old and over to nearly 85% of our population. For 5-year-olds and over, my daughter's one of those, and she got vaccinated both of her shots. That number is 78% that are at least 1 shot and 70% fully vaccinated. This is easy to do. You can go to your local pharmacy, you can go to your local healthcare provider, or to one of our sites by going to coronavirus.lacity.org and get a free vaccine or a booster. Now, in the past, we said wait 6 months for a booster, but most of the research is now showing that that's a pretty arbitrary date, that 3 to 5 months after your second shot, it's okay, it's fine. It's actually probably smart to get your booster. And in fact, if you look at the Omicron variant, if you are boosted, you have a 55 to 80% greater chance of not getting infected. With just 2 shots, that could be as low as 0 to 20%, especially after those first 6 months. So do it, and do it now. And make sure those who have been riding the fence, who have been hesitant, can now see the evidence of just how effective this is. It might not 100% keep you from getting COVID-19. I'm evidence of that. But it certainly will keep you from a hospital and keep you from death. That is what we want. Lives saved and hospitalizations to be relaxed. Right now we have about 750 people who are hospitalized. But as we saw in Great Britain, in a 2-day period, we saw hospitalizations double and deaths double. This is already the 3rd biggest peak of cases in our history. And while we're better protected now, I have no doubt that what happens in other places like New York and the Northeast comes to LA eventually, as we saw last year when our surge was later than them. That means that we probably will have the second, if not the first biggest number of cases on a daily basis soon from Omicron. If, with your help, though, we are vaccinated and boosted, it doesn't have to be the most people hospitalized, and certainly not the most people who die from this as well. This is a crucial moment for us all. And I know how exhausted you are. I know how exhausted I am. But this is a moment for us to take all the wisdom and the knowledge that we have and do something about that. If you have visitors who are visiting from out of town, make sure that they're vaccinated. And if they're already vaccinated, get them boosted. And if they're boosted, make sure that they know their status. You can get free testing, and we are surging up testing. We still have free testing, Dodger Stadium with our partner Curative, in South Los Angeles and Highland Park. And tests are available everywhere, as well as the President's announcement that in-home testing in January will be available, 500 million of those tests to Americans who can take those tests at home. Remember our healthcare workers. I talked to a nurse today as I visited a hospital. They're exhausted. They're still pulling double shifts. Our inability to get vaccinated or boosted means they have to work harder. They have to witness more tragedy. They're seeing that, and it's taking a toll on them. And I want to thank our healthcare workers and our hospital workers, our essential workers. And I want to say I see you, I thank you, and we are with you. I know that many of you are planning to travel for the holidays, and as Dr. Fauci said, there's no reason to cancel those plans, especially if you're vaccinated and boosted and you wear a mask on the plane. If you come through LAX, we have testing available there too. And whether you're traveling or staying in LA, I want to review what you can do. First, get that vaccination and booster. Second, make sure you get tested. And again, you can find all those testing locations in places like here at Union Station at coronavirus.lacity.org. And be smart. Continue to do those things that have protected us for a long time. And it's important to remember that testing just gives you a snapshot in time. So do it frequently. And if you think you've been exposed, don't just rely on an antigen test. If you're pretty confident, get a PCR test because it can catch you before you're contagious. In fact, that's what happened to me. Taking a PCR test to come back into the country, I was able to catch my COVID before I infected anybody. And people I was with the night after that, none of them got infected because we caught it early. An antigen test, sometimes it will be a day or two later when you are infectious. Mask up, wash your hands, keep your distance, do all of those things you've done so beautifully. And maybe it's time to upgrade your mask. Get yourself some N95 or K95 or surgical masks and wear one of those on its own or double up a cloth mask as we've done in the past. We know this is a colder time. We know more people are indoors. We know, as we saw last year, this is when cases spike. Finally, I want to say, I know we can do this, LA. We are not going to repeat January of 2020. It was the worst month in the city's history. We had more people die, more of our loved ones lost, so many who are still feeling the effects of ongoing effects of COVID. And you've demonstrated time and time again that you can protect yourselves, your families, and others. Go out there and help people who are in need, whether it's donating to a local charity, going to the Mayor's Fund at mayorsfundla.org. Make sure that those folks who are looking to put food on their table, might need assistance, that we all help one another. But the best thing we can do is to make sure that we're safe from this onslaught. So stay healthy, stay vigilant, and as always, I'm wishing you strength and love, Los Angeles. I'll take some questions and I'll come back and I'll do the same words in Spanish as well. Yes, sir. Yeah. I don't see a lockdown. I think we're so much better protected than we were. I do think that restrictions such as masking indoors will continue, especially as these cases go up. We'll have to follow our hospitalization very carefully. I was hoping that as early as sometime in January, we would have reduced hospitalizations, boosted our vaccination rate, and had our caseload be at a level where we could relax those masking requirements. But I think that's been put off by at least a month, if not two. But right now, no, talking with Barbara Ferrer, with my fellow mayors who have their public health departments, we're not looking at further restriction. We want to control this. Really, this is something we can manage, but we're already seeing places like Maine, Rhode Island being overwhelmed in their hospitals, and we just want to protect our health care. Any of the what from federal government? Sorry. So, yes, exactly.
Federal assets coming into LA,
Yeah.
personnel, doses, whatever.
We do anticipate potentially benefiting from the mobilization of all the medical personnel from the Department of Defense. If we need that, it's certainly been made available, but we also have that through the State National Guard. Right now, we feel like our medical capacity is holding. We have enough personnel. We have enough beds. Nationwide, our beds are about 75% filled in our ICU. About 20% of those are COVID. So if we see COVID double, we're going to see basically no beds available soon. And we'll look at what we have. We can surge up some of the field hospitals that we have. White Memorial just down here, for instance, still has that available. We have other places that we can do that quickly, but right now, while available, we're not calling for that.
From your judgment for people who are currently operating the health system, if we had to upgrade the number of beds, things we have to do, can we do it in 48 hours, 72 hours?
We can do it quite quickly, and we can, most importantly, we can do it inside the hospitals. We've already shown that. The hospitals have already taken that down to the pre-pandemic levels. We can get that back to levels that we have in the pandemic just by changing some of the configurations in hospitals. But let's be clear, that means other people who need very important surgeries, those could be put off. That means that the healthcare system will be strained, and people who need an emergency bed from a car accident, from something else tragic, those beds are going to be harder and harder to come by.
Outside the hospitals, though, is there a list and a protocol already set so that if you or the county makes a decision,
yes,
you flip a switch and you've got centers that are popping open in 12-hour increments?
If we need it, but it's much faster to do that inside the hospital, and there's greater capacities inside the hospital. If you added up all of those field ones, you're more like 5 to 6-fold just inside hospital capacity.
Are you saying that if the number of COVID cases doubles, our hospitals will be full?
If the number of people who are there in intensive care because of COVID, nationwide, yes, we would on average be pretty much filled. Now, hospitals can surge more beds. That's what we did last year. So I don't think we'd stay static, but you can only keep doing that for so long. Any questions?
En otras ciudades se ha visto que hay largas filas porque no hay suficientes pruebas. ¿Aquí se prevé que eso suceda?
Sí, tenemos muchas pruebas aquí en Los Ángeles y con el condado de Los Ángeles tenemos muchas parejas en la comunidad. Por ejemplo, las clínicas, organizaciones comunitarias y el condado y la ciudad de Los Ángeles. Hay muchas pruebas ahora y estas pruebas son gratis. Es muy importante para nuestra comunidad porque es muy caro tener una prueba cada semana por todos los miembros de la familia. Por eso es importante para aprender dónde están estas pruebas y estas pruebas gratis. Este punto no, pero en otras partes de este país es la realidad. Pero aquí tenemos suficiente pruebas en Los Ángeles. Sí. Until the day that I am, my last day as mayor, it's difficult to think about anything besides running the city. All right. Let me say a couple words in Spanish too. Okay. Buenas tardes, Los Ángeles, y gracias por venir. Nos enfrentamos a un nuevo enemigo en la lucha contra COVID-19, la variante Omicron. Cuando el presidente se dirigió a la nación esta mañana, identificó nuestra arma más eficaz en esta lucha, la vacuna. Hoy quiero repetir ese mensaje e instar a todos a vacunarse y ponerse el refuerzo a medida que nos acercamos a la temporada navideña. Si no está vacunado, tiene 7 veces más probabilidades de contraer el virus. Debe continuar lavándose las manos con frecuencia y usar una mascarilla, especialmente en interiores durante las fiestas. Y si cree que está expuesto o si tiene síntomas de COVID, debe hacerse una prueba. Y hay pruebas en Los Ángeles, pruebas gratis. También debe considerar hacerse la prueba antes de asistir a cualquier reunión navideña en interiores, especialmente con nuestros parientes que están viajando a Los Ángeles durante este tiempo. Para encontrar un sitio de prueba o vacuna cerca de usted, vaya a coronavirus.lcity.org. Les deseo una feliz y saludable temporada navideña y año nuevo. Muchísimas gracias, fuerza y amor, Los Ángeles. All right. Thanks, everybody. Appreciate you coming out on short notice.